February 14th Provider Collaborative webinar, so thank you all for joining today. Our agenda is as follows. We'll go through introductions here in a moment. We'll talk about the OHP Client Agreement to Pay for Health Services form. We'll talk about OHP newborn notifications, the enrollment process for newborns, as well as some reminders around using the Community Partner Assistance Consent Form for those of you who are OHP application assisters. All right, so as I mentioned, I'm Colette Bird. I'm the Community Partner Outreach Program Provider Campaign Coordinator. And in the room we have
Brent Coffey, Oregon Health Plan.
And
Nancy Wood, Oregon Health Authority, Health System.
And thank you guys so much. These are our subject matter experts for today, so thank you guys for joining us. We're going to jump right in and talk about the OHP Client Agreement to Pay for Health Services form. So in your handouts, you do have a blank copy of this form. We'll talk about when to complete it. This form number, which is 3165, this form should be completed if a service that is being provided to a patient is not covered by OHP and the patient has OHP. In some circumstances, a client may want to pay for a covered service. If that is the case, you can use this form to capture that and document on the form that the client knowingly and is voluntarily agreeing to pay. If OHP has denied the service and the client has requested a hearing, if the service is going to be performed before the hearing decision, this form can be used so that the client can be billed if that final decision is not in favor of the client as well. So really only those who are provider assisters or non-assister OHP providers should be assisting patients with these forms. Part of the reason why we wanted to talk about this form is because we do hear of some misuse of this form. So a few of those scenarios are listed here. So we don't want providers to be using this form as a backup for when a prior authorization is pending. We've gotten the question before that members who have CALM, do they need to complete this form? And the answer is no. Members who have CALM, as you know, these are emergency-only services that are covered under CALM, so the vast majority of services would not be covered. And so in those situations, this form does not need to be completed for folks on CALM if they are accessing services. We've also seen that this form will be completed if a provider is uncertain as to whether the service is covered or not. It is the OHP provider's responsibility to confirm if a service is covered before delivery. So let's look at a blank copy of this form. And some of you may never have seen this form before and are not assisting patients with this, and that's totally fine. You may run into it, so it is good to have this background understanding. So ultimately, the form 3165, in the first section, it asks for provider information. So what are those healthcare services that are being requested? Super important to provide the procedure codes, expected dates of service, condition being treated, and the estimated fees. You would then indicate if there are no other costs that are part of the service, or letting the patient know that there may be other costs that are a part of the service and you may have to pay for them too, such as labs, x-rays, anesthesia, hospital services, etc. Then we want to provide the provider's name, their NPI, as well as their signature and date. The client then is going to complete their name, date of birth, client ID. This is also called the prime number or member ID. And that they understand what they're agreeing to, which is ultimately being responsible to pay for the services that they are receiving. They'd want to sign in date, and then usually the witness is going to be an office personnel individual. So some other common errors that we do see is that the 3165 has a range of CPT codes. So again, it is the provider's responsibility to determine what services they're delivering that are not covered by OHP. So they do need to provide specific CPT codes. We also see that the 3165 has a price range that is clearly much higher than what one service would cost. And then at other times, a generic check in the form is used that does not specify the service and cost to be billed.
That was not the registration form
Mm-hmm.
from the office itself.
So like a registration form, Nancy's confirming from the office itself. And again, just a reminder that the 3165 must be specific for the service that is being performed. Okay, so that was short and sweet, but we look like we do have questions here. So hang on one second. So question is, the 3165 revised 1113. There is a more updated form, which was dated August 13th, 2014. We should use the updated one, correct? Yes, Melody, thank you. And I will make sure to send the most up-to-date form as well. And then another question. Thanks for your patience, guys. Just a moment.
Wow. Well, yes, they have. Go ahead.
So the question is, can a client refuse to sign this form if a provider tries to make them sign solely because a pre-authorization is still pending? Some providers state they will have to cancel the appointment if the client doesn't sign.
Unfortunately, I don't think it would be right to have them sign for it. We don't know if the service it's covered and say the diagnosis doesn't match. I mean, there's so many variables there. Unfortunately, most providers are going to end up canceling and waiting until the prior authorization has a decision, approved or needs more information or whatever. I know that's difficult on the schedule and canceling appointments, especially for something that's planned out, or even an outpatient surgery and everybody's lined up. But I don't think it would be appropriate to have them sign for it on a guess. I think it's better and prudent to wait for the authorization.
And we talked about this. On the form, I have any doctor can sign after reviewing the patient's chart, or does it have to be the provider that is performing the service? It can be anyone within that provider organization. Yeah, good question. And then, Melissa, who should be the witness? That should be someone who is employed by the provider. So an office personnel is sufficient, but they would need to be, a staff person within that provider organization. Okay, any other questions on this section? Great, we will have another opportunity to review questions as well. And question, or Melissa, your follow-up was, and only assisters can complete the form with the patient. No, that's not true. Anyone who is basically a staff person within that provider organization could assist with this form. That includes provider assisters, so those who are employed by OHP provider organizations. All right, moving on to newborn notifications, which I know has been a very hot topic for many of our provider assisters recently. So as we mentioned, we have Brent Coffey here, who is our subject matter expert. Let's dive right in. We're talking about the newborn notification form and all that goes into it. So that is Form HE 2410. This form should be used by non-assister OHP providers and provider assisters, as well as non-provider assisters to add newborns to existing households. So if you're unsure where you fit in, let's connect offline and we'll make sure that you're very clear on that. We're going to start by filling out a sample that we've already filled out ahead of time, but we're going to show you an example of what that looks like. So the newborn notification form, you want to provide the provider information there at the top, so business or clinic name, address, phone number, fax number, contact person. To have this section completely filled out is very important, and we'll talk about why in just a little bit. We need to know if you're reporting multiple births, the date of birth, and then complete the following sections for each newborn. So in this example, we have a set of twins, Bobby and Bobby, to keep things super simple. And then we have male and female. And so we have that section completed in full. We want the birth mother's information, her date of birth, social security number if she has one, and Oregon Medicaid ID. In this example, the newborns are being discharged with the birth parent, and Brent had advised in adding an additional note of just saying, in this situation, let's say that the family is still inpatient, to note that they are anticipated to discharge with birth mom as opposed to being placed in child welfare, adopted, or deceased. When to use this form. So this newborn notification form really should only be used if mom has Oregon Health Plan, and this includes Count or Count Plus, or if baby is being released to DHS Child Welfare, because this form will be used for OHP customer service to alert DHS Child Welfare of the newborn. Talk about how to use this form. So again, we have non-assister providers and provider assisters. So these are either provider assisters who are OHP application assisters employed by OHP provider organizations, or they're not application assisters, but they're just staff that work for an OHP provider organization. So either of these groups can submit through fax without a consent form. So that's just part of the access they have as a OHP provider, is to be able to notify OHP of newborns for existing OHP cases. So the fax number is on the form that we just looked at, but we'll reiterate that at the end. And then all certified OHP application assisters, so this includes provider assisters and non-provider assisters, could also submit this form through the ohp.outreach email address. But if this is the route that you're taking, you must include a consent form or have already had this household associated to your Oregon eligibility accounts, meaning you already had a consent form on file for this household. We encourage anyone who is assisting with this form to submit it as quickly as possible, and it is okay if mom is still inpatient at that time. So we also want to highlight when not to use the newborn notification form. If mom doesn't have OHP, again, if she doesn't have OHP COWM or COWM Plus, and or the child is not being released to DHS child welfare. So if you're wanting to submit a form and mom doesn't have OHP, you're going to have to complete a full application to get the newborn onto OHP. Some common errors that we see: missing information for the staff person completing this form. So their full name, phone number, and fax number. And this is super important to include, because if there is key information missing from the application or there's an error, then OHP customer service doesn't have any way to get a hold of the person who submitted this form. So we often see like very general information, that just the hospital's name, and then have trouble tracking down who that person is that submitted the form, which can further delay the benefits being active for the newborn. So I'm going to pause there. We've covered a lot, and pull up our questions, so hang tight. So question is, who would be the contact person? So for example, Kaiser is a huge organization. Who would be the person that is going to be assisting with that form? Really, that could be anyone within the organization that can be a resource moving forward, who could say, if there was an error on the notification form, that we could reach out to confirm. So this can be anyone really within the organization that makes sense on your end. So good question.
Jose's question is a good one too.
Okay, so Jose's question: would there need to be an Oregon Medicaid ID for the mother in order to get the newborn covered?
Mom needs to have an ID number. Yeah, that means that she has coverage.
So yes, Jose, we would need mom's Medicaid ID in order for the newborn to get covered through the newborn notification process. If mom wasn't a Medicaid recipient, we could still get the newborn covered if eligible. They would just need a full application for the baby. Can we note that they are or need an American Indian Alaska Native indicator?
They can, and if we see it also on the application, or mom's one case, we'll also mark down that they're American Indian.
Mm-hmm. So good question, Victoria. You can indicate that, but we will in a few slides later talk about that the demographic information does follow that of mom. So if mom had an AIAN indicator or an HNA indicator, then the baby would as well. And that could be changed just by contacting OHP customer service as well.
Right. After notification, how long does it take to get the baby?
So Wendy, we'll cover your question about processing time in a moment. So Deanna, your question: if a client has a consent form for notifying provider, which is less than a year old, i.e. is current, but the client has not been associated with another Community Partners One applicant port dashboard, can the original community partner still submit a newborn notification form based on having that consent form on file, though not currently associated in the AP? So if they're not associated, so if they're a provider, they can utilize the fax process and the newborn notification process without a consent form. If they're not a provider and are using the ohp.outreach inbox to report the newborn, then they would either need to submit a consent form, or that household would have needed to already been associated with that community partners organization in one. Megan, I think this probably answered your question, but is a community partner consent form required to submit the newborn notification form, or just if we need to call on it? So again, it is a provider form, so it does need to be, if you're going to fax it in, it does need to be completed by an OHP provider organization. And to fax it in, you don't need to submit a consent form with that form.
Melody's question, if Legacy faxes the newborn notification form, do we still need a consent form signed to check? No, because they fax, we deal a lot with the 7 or 8 legacies, and they just have people to fax it right there. We don't ever take consent forms.
Mm-hmm. So if they're being faxed in Melody, then no, you don't need a consent form faxed in from Legacy. That's totally fine. And then to check the status by calling Brent's number, which we'll provide here in a moment, you wouldn't need that consent form. I think where we get a lot of confusion is by calling the community partner line. The community partner line, you are going to need to be associated with the case in order to check the status of the case, including newborns.
Ashley says there's more to it. How long is the newborn initially covered after the notification form is received? It's covered from date of birth for a year.
Okay, so Ashley, your question, how long is the newborn initially covered after the notification form is received? So it's not after the notification form is received, it's from date of birth, but from date of birth, they would be covered for a year. Newborns have protected eligibility for 1 year, so that should be what the experience is. Okay, so again, I think that we have some folks who were saying that they weren't able to get the status of a newborn notification form when you're calling the community partner line, and that would be correct. You wouldn't be able to get the status of a newborn notification by calling the community partner line unless you had also submitted a consent form. We'll talk more about checking the status and what to expect as far as processing time goes for when you're faxing in those newborn notifications here shortly.
Return protection doesn't cover return mail through, correct? Newborn protection doesn't cover.
Dina, could you maybe restate your question? And then we'll come back to this. Okay, so I think we're going to cover some of these additional questions in our next slide, so we're going to move forward. So some common errors we see with the newborn notifications. Baby name is incorrect, so was submitted with or without needed hyphens in the name, or the legal name is missing. We see mom's prime number is missing. We do need that. Mom's SSN is missing. Now, if she doesn't have one, that's okay. We still would want to provide that prime number. We also see that the newborn status is missing. And I'm going to let Brent talk a little bit about why this could result in a HIPAA violation.
When newborns are born and they're adopted out, we need to know that information because it's probably going to have a new name on it, like baby boy or baby girl Smith. And we do not want to connect that baby at all to birth mom's case. We are going to put baby boy Smith, or baby girl Smith, whichever one is appropriate, because we don't want to have mom have any way of knowing where her child is going. Same thing with deceased children. If we don't know about children that are deceased, we'll be sending out a medical card to mom's house that she's not going to be, probably going to sadden her quite a bit. She's already gone through enough traumatic event with the loss of the child. Now we've just sent her a medical card for the child. And then child welfare, we don't want mom to know where the child is at by sending a medical card that she can possibly go to the doctor and find out information about where her child is at. So we need to know if mom's lost the child temporarily due to taken by child welfare. So those things are very important for us to know. And usually one of us will be calling you if we don't have that information there.
Thank you. And often when a baby's information is missing or is incomplete, OHP customer service can and will check OVERS, which is the birth certificate database. However, some of those entries can also have been made in error by the provider, by the provider as well. So as long as that provider's information is present on the newborn notification, then OHP customer service can work with the provider and or the parent to make corrections and notify them as needed. We also see that some providers are having the new moms complete the form without any assistance. And so in that situation, you know, mom has just given birth, and often it is completed with errors. So as much as possible, this is a form that should be completed in conjunction with a staff person at the provider organization, as well as with the parent, with mom. We also see that the form is completed by mom without a needed interpreter or necessary translation services. So the provider should be providing those services if needed to mom, so that for a number of reasons, of course, but also so that this paperwork is completed accurately and mom understands what she is providing on this form. And as Brent mentioned, in order to protect the privacy of a child who will be adopted or is going into DHS child welfare custody, you can put down the birth mom's name and baby boy or baby girl so that that baby is covered at the date of birth, but so that the baby's information is not going to, or so that the adoptive parent's information is not going to be shared. Help me out here, Brent.
So we don't give mom any information about baby.
Right. Thank you. All right, so we've covered a couple more. We'll go through and look at some questions here. So question, so then we should just fax consent form as well to make sure that we may follow up on the case. So there are two separate teams that we're looking at here. So the team that manages the newborn notifications that are being faxed are separate from the team that is going to be monitoring and answering the community partner line, as well as the OHP.outreach inbox. If you're emailing in the newborn notification to OHP.outreach, you must include the consent form if you as a community partner are not already associated to that household. If you're a provider, you can fax this form in and can call, and we'll provide a number here soon after we talk about expected processing time, and can call to check the status. But as long as you're a provider, you wouldn't need to have faxed in that consent form with the newborn notification.
Next one is not my area of expertise. That's mail back from a household. Next, and that one, are moms provided with newborn notifications form? No, they're not. Those are for the professionals at the doctor's offices, hospitals, birthing areas. They have the form.
And we can certainly provide copies of the newborn notification form as well, and I'll make sure to get an updated copy to everyone here. There was a question, will newborn benefits terminate if OHP gets returned mail back from the household? So that's a great question, Dina. I'm not positive about newborns, and I'll have to follow up on that one. So if a baby is being adopted, we only want to put baby boy or baby girl with birth mom's last name as baby's name and mark the status as adopted.
And the date that it was adopted.
And the date that it was adopted, Brenda. Good question. So Alma, we'll get to your question about CCO enrollment shortly. And Melody Jackson just wants to say on behalf of financial counselors at Legacy Health, we love Brent Coffee. You are our Valentine.
Thank you, thank you, thank you.
Thank you, Melody.
Legacy is the Cadillac of all the people that give me information. Their stuff's the best.
So keep up the good work, Melody, and your team. Thank you. Okay, you guys, moving forward. So just some general reminders. Newborn's demographic information, if provided, would follow that of mom. So if mom had provided demographic information like American Indian, Alaska Native status, or also known as the HNA indicator, if that's provided on the application, then baby would follow that of what mom had indicated, as well as race, ethnicity, and language. But of course, the household can always call OHP customer service to make changes and updates to this information if needed. Okay, so I'm actually going to move forward here and talk about new processing time and then newborn enrollment, since I know many of your questions are coming in are around these two topics. So processing time of the newborn notifications can vary. If the form is complete, so we've talked through a number of reminders, it is usually processed within 3 weeks. This processing time can, as you all very well know, can be affected by call volume, the time of the month, whether it's, renewals are being worked at this time, staff capacity changes, etc. Now, we are releasing Brent's contact information, who works directly with these newborn notifications. We ask that you respectfully use this number sparingly and to wait the necessary time for the form to process before reaching out. Something else that needs to be shared is that there is a minor glitch happening in the system right now, in the one system, in which newborns added from the previous months are starting the first of the current month in error. So this is often being caught and corrected. But if you're seeing this error happen in the system, you can contact Brent, who can help make this correction while we work out a fix for the issue. So for example, if you submitted newborn notification for a baby born at the end of January and it gets processed in February, we're seeing that the system will automatically have the benefits go back to the 1st of February instead of that January date of birth. So when this is being caught, it is being corrected, but it is something for you guys who are handling newborn notifications to know that this is happening. Anything to add?
Call us when that happens. It usually we can have it done within 24 hours. We can have it fixed to go back to date of birth.
Great. All right, let's talk about CCO enrollment for newborns. We get a lot of questions about this. So if mom is enrolled in a CCO when the baby is born, the newborn will typically be enrolled into the same CCO starting at the baby's date of birth within 1 to 2 weeks of the newborn notification being processed. So let's use the example of baby is born on my birthday, February 10th, and reports the newborn notification gets submitted, and mom is enrolled into a CCO. Within that newborn, when that newborn notification form is processed, so again, allowing for about 3 weeks, once that newborn notification form is processed, then within 1 to 2 weeks of that form being processed, CCO enrollment will go back to the date of birth for baby, and that is for these situations, and that would be within 1 to 2 weeks of that form being processed. So that is what to expect when mom is enrolled into a CCO. An exception to that would be newborns who have that AI or AN indicator, the HNA indicator, and those who have TPL. Now, if mom is not enrolled into a CCO, but is on OHP, so let's say she has fee-for-service or open card under CALM, CALM Plus, or maybe she has other private health coverage or has an HNA indicator, the newborn will be covered through OHP or fee-for-service open card at the date of birth. And then would be enrolled into a CCO with a start date of 1 to 2 weeks following the newborn notification form being processed. So I did misspeak there, though. That would not be the process for a baby with an HNA indicator. That would just be for those that have, when mom has CALM, CALM Plus, or is on fee-for-service or open card, because of TPL, she has other private health coverage as well.
If mom is going to stay fee-for-service and they want to know which CCO the child's going to be enrolled in, if they can see other kids in the family, the computer will pick whatever the other children are and make the newborn that. Okay.
So that's a good point of clarification. If other members of the household are enrolled into a specific CCO, the CCO enrollment logic would follow what CCO other household members are enrolled in, as long as that baby, was in the same service area as those household members as well. So I'm going to take questions now because I feel like both of these are hot topics. So if they have TPL, Rachel, then they would go on to fee-for-service at the date of birth. And if the baby has TPL as well, then the baby would stay OHP for fee-for-service. But if mom had TPL, and which is why she was open card fee-for-service, baby would still get enrolled into a CCO, but it wouldn't take place until 1 to 2 weeks after that newborn notification form was processed. If there are urgent medical needs for baby, can it be processed quicker than the 3-week time frame? Yes, Billy, it can be. And who should we contact in that situation? You could contact Brent.
But it doesn't happen very often. It does happen, but it doesn't happen as much as people think. But if there's a real need, child has durable medical goods or needs medication, or it needs to go see a specialist, and the specialist will not take a child that does not have an ID number yet, call us up. We will go in and do it immediately. We use that very sparingly, but it does happen.
Right. All right, moving right along. So guidance for providers on when to bill for services for newborns. Safely waiting 30 days is the best practice there. And that's to allow for adequate time for the CCO enrollment logic to take place and for that newborn notification form to be processed. There are a number of situations that can complicate enrollments. Newborn was fee-for-service or open card and remained in the hospital well after the birth, but client enrollment services wasn't notified. So in some situations, you know, if the baby needs to stay on fee-for-service while they're inpatient, providers can notify client enrollment services, but they will follow that enrollment logic that we just outlined, unless client enrollment services is notified for the baby needing to remain on fee-for-service. We also see that the newborn hasn't been added to MMIS or wasn't added in a timely manner. It does happen. The newborn's date of birth isn't correct in MMIS. That can happen for a variety of reasons as well. We also see the biological mother may change service areas before the newborn's enrollment is updated in MMIS. Also, biological mother and newborn are on different cases, like we've outlined already. The newborn is taken into custody of DHS Child Welfare before enrollment is updated in MMIS. This definitely happens. Newborn may be adopted privately before enrollment is updated in MMIS as well. And if any of these issues are coming up and you think it's an error, you can always, provider assisters and non-provider assisters, again, with those necessary signed consent forms, can reach out to ohp.outreach and provide, you know, the typical case information. And I imagine you could also reach out to Brent if some of those issues come up that seem incorrect.
Yeah.
After waiting for that appropriate processing time.
Client services is also a good group of people here to call about when the enrollment's going to happen and when it isn't going to happen, because that's their main thing that they do.
Great. Okay. Definitely more questions. What's the easiest way to correct if an American Indian or Alaska Native newborn is still being the only one placed in a CCO, still happening with our cases? So Victoria, are you saying that a baby is being placed on a CCO automatically when they should be fee-for-service because everyone else in the household is fee? Okay, yes. Okay, in that situation, what would be the best?
Client enrollment services, or what we used to call the phone bank, they'll go ahead and make the changes.
Okay, so you should be able to call, well, for community partners, you should be able to call the community partner team. I'm not sure if that's something that the tribal request team would be able to assist with, but I can double check on that as well.
Next one down, which is one I was hoping we could hit. If no newborn is adopted, they are generally adopted at discharge of newborn. OHP is responsible for the newborn from the date of birth to the discharge date. Right, if the baby was born on the 1st of any given month and was discharged on the 3rd, we're going to pay for insurance all the way until midnight on the date of the 3rd. On the 4th, it's up to the adopted parents to start their new medical plan for the child.
All right, when a newborn is rolled into a CCO and mom is covered by the CCO, the effective date is not the effective date of birth. The effective date is the date of the CCO enrollment. I'm not sure if I'm understanding your question, Marcella. When mom is on a CCO, once all of the paperwork is processed and the enrollment logic takes place, newborns CCO enrollment in most cases will be the same as mom. The CCO will be the same, and it will go back to the date of birth. So that is a situation, one of the only situations where retroactive CCO enrollment takes place. We have a question. You were faxing in newborn notifications as urgent when they're in the NICU. Is that still necessary?
We still go ahead and process them as urgent, even though that's not urgent. The child's not in any danger. He's in the NICU. He's in the best place he or she can be. But we do still process those much quicker, usually within 24 hours, if that answers the question. Yeah, so all cases you just mentioned will go to CES. If you have questions about enrollment information, if it's not marked with the right indicators or the dates are wrong, yeah, Client Enrollment Services or CES is the place to start.
Retro CCO enrollment. So Deanna, just that when mom has a CCO, is enrolled in a CCO, and a newborn notification is processed, within 1 to 2 weeks of that newborn notification being processed, the baby's CCO enrollment will go back to the date of birth. So will go retroactive back to the date of birth. That is one of the only situations that CCO enrollment is retroactive. Any other questions on this topic before we move forward? All right, thanks you guys, great questions. Okay, so our last topic today is on the Community Partner Assistance Consent Form reminders. So most of you, it is appearing are community partners, which is great. And so with every application you're assisting with, you're collecting a consent form. And they should be submitted, as you know, to ohp.outreach@dhsoha.state.or.us or via fax, but they are often incomplete. We're seeing a good number of them that are incomplete. So we'll walk through a couple examples of what we're seeing. We'll see that the applicant's date of birth, phone number, name, etc. are missing, and only the community partners information is present. We're seeing a signature by the client, which is critical, is also missing. We are seeing that the organization and the community partners information and assister ID are all missing, as well as number of other adults on the application, etc. So we are seeing a number of fields missing in the consent forms that are coming in. So just remember to spell out the organization's name and the assister's name. Provide client information completely and legibly. A lot of our community partners will pre-populate, so they'll type into the consent form with their information, and then every time they provide assistance, they just have the applicant information completed so that their information is already there, clear, typed out, and then we'll just populate what they need to for the client information. The client must sign the consent form. It is not valid unless the client has signed. So short and sweet, we are seeing a trend though of consent forms coming in incomplete. So I just want to make sure you are all aware of that. Does every adult have to sign the form? No, you just need an adult in that household to sign the consent form. Other questions? There are a few questions that we are going to take offline and follow up directly. So do know that if you hadn't heard your question being read out, but we have been able to address 99%, which is great. All right, as we wait for more questions to come in, our last slide here is our next collaborative is happening on Tuesday, March 13th from 9:30 to 11. The topic will be care coordination for non-tribal OHP members on fee-for-service or open card. So we'll have KeyPro join us to talk about that service for, again, fee-for-service open card members. Okay, you have another question about the 3165. Go ahead, Melissa. Go ahead and type that in when you're ready. I'd seen another one too.
Yeah, I can answer that.
Okay. So one of the other questions from earlier around the 3165, if facilities have their own notice of non-covered services form that they use for all insurance plans, is this
Acceptable to use your own form. It just simply has to have the specifics. You have to have the CPT code and you have to have the charges. It often at registration, when the patient comes in, there's a generic form that says if the services today aren't covered by your insurance, you agree to pay for them. That is not sufficient. The provider's responsible to know what's covered and what's not, and to spell out this service on this day at this charge is not covered, and you agree that you want to move forward and pay for that yourself. So yes, use your own form as long as it's specific.
So if another doctor signs a form and says that a separate 3165 was done with the other doctor, I'm not sure, can you maybe restate that as a question? Please? Thank you, Melissa. Brenda, did you have a question about the CPT code and ICD-10 codes? If you could restate that. Can you fax and consent forms with renewals or new applications? Yes, Alma, you can fax and consent forms with renewals and or with new applications. You can also email those consent forms to OHP. Do CPT codes and ICD-10 codes need to be on the form?
The CPT needs to be on the form. Often we see a more layman person diagnosis or condition. That would be up to you. It has to be, but the CPT code, the service, is where the charges come from. I suppose if you want to be specific on the diagnosis with your ICD-10, that's fine. You just want to make sure that the patient understands what it is too.
Okay, thanks for restating, Melissa. So it says the section, any other provider, says, I understand that your provider has talked with you about other choices and completed a separate agreement to pay for. So the question is, do we have to have two 3165 forms in that situation?
It sounds like there's two separate services. So maybe I go to the doctor and I'm going to have a procedure done that requires lab work or some additional service with a different provider. So in that case, the form would be provider specific. So yes, you would have two, but I can't see where the same office would need two for the same service. Does that make sense?
Yep, we can definitely connect offline, Melissa, to go a little deeper on that. Okay, other questions?
Thanks for your question, Melody. The reason we prefer the 3165 is because it spells out exactly what the service is and care. has an ABA form, we'll accept that also. If the provider wants to create their own form, but is service specific and has the same components, then yes, you can use your form, but it has to be that similar.
So it has to collect all of the information that the 3165 does.
Right. I mean, basically, you're just repeating the 3165 in your own letterhead. That would be fine. It doesn't have to be the DHS form, but it does have to have the same components, yes.
All right, looks like our questions are slowing down. If anyone has any other questions, please type them in now. You can always reach me after the fact via email as well, and we will work on those questions that we weren't able to answer right here and now to follow up directly with folks who attended today. Okay, well, thank you guys so much for your questions and all of your attendance. Again, please feel free to reach out as other questions come up. You do have a copy of this presentation in your handout section, so you can grab those and drag them to your dashboard before we leave. I will make sure to send the most up-to-date newborn notification form via email. And thanks again. We'll talk to you all soon, and have a great rest of your day.